At the recent American Society of Retina Specialists meeting, you presented a paper entitled Mythbusters: Does Vitrectomy at Time of Brachytherapy in Choroidal Melanoma Influence Survival? Could you sort of outline your paper for us?
Sure, yeah, thank you. So in eyes that have had a melanoma in it, there's a lot of controversy about whether it's safe to perform surgery, whether it's cataract surgery or a vitrectomy to remove vitreous hemorrhage or to repair retinal detachment. People are worried that doing surgery or manipulating the eye is going to cause cancer to spread in the orbit or even influence the risk at which a patient may develop metastasis, which is obviously the worst case scenario. And at our center, we do vitrectomy and silicone oil placement to help shield the optic nerve and macula from the side effects of radiation. So we have about 7 years of experience doing surgery like this. And our paper was to review patients' mortality secondary to metastasis in this cohort of patients. So we had a total of 283 patients that we looked at their metastatic outcomes and basically found that their survival rate was no different than the large series in the collaborative ocular melanoma study. So essentially that means if a patient needs a vitrectomy or a cataract procedure in an eye that has been treated for a melanoma, you are not going to cause harm to the patient by performing surgery.
What can a physician look for in that situation when he comes to a patient? What are they looking for?
So if there's a patient that has oftentimes a secondary comorbidity such as glaucoma, or a patient has developed a macular pucker and the eye has had a melanoma that has been treated in the past, most of the times people are not interested in proceeding with surgery. However, our data, where we do a significant amount of surgery on the anterior segment and posterior segment and treat the melanoma, if we don't cause increased risk of metastasis, clinicians who see patients who have had melanoma in their eye as part of their past history can feel comfortable performing much needed surgical treatment therapies.
And final question, what's the take-home message for the clinician?
The take-home message is performing intraocular surgery in an eye with a uveal melanoma does not increase the risk of metastasis. So you're not harming the patient, you're not hastening their demise.
Yeah. Thank you, doctor. Appreciate your time.
You're welcome.